If you come into contact with blood or other bodily fluids, it is imperative that you wash your hands thoroughly with soap and water for at least 30 seconds. Be sure to rub all of the surfaces of your hands, including between your fingers and the sides of your hands. Rinse well and use a paper towel to dry your hands. Then use a paper towel to turn off the faucet. These preventative measures will protect you and the people around you.
What if an incident occurs when there are no other staff members around?
Good point. Of course, safety is your first concern. If necessary and possible, take both students to the school office and request assistance. One reason for these trainings is so that all staff members will be aware of the steps to take, whether or not they are familiar with the individual students. If a student or you has cuts or scratches, be sure to cover the injury with a Band-Aid until they are healed. If the wound is bleeding, use absorbent material to act as a barrier while pressure is applied. Staff members may encourage the student to apply pressure to his wound, or staff members may place their hand over the student's hand to assist in applying pressure. Anytime you encounter large amounts of blood or bodily fluids, be sure to wear rubber gloves. This is true when you are disposing of bloody gauze or paper toweling as well. Once you remove the gloves, wash your hands as we just described. Never reuse the gloves. If a custodian is not readily available, use absorbent material to clean up blood or bodily fluid spills and wash the area with soapy water and disinfect immediately. Leave the disinfectant on the area for at least 10 minutes before wiping it up. If a student's clothing becomes contaminated with blood, the clothing must be placed in a sealed plastic bag to be taken home and washed in hot soapy water by the student's parents. If classroom or playground toys or teaching materials get blood on them, they must be soaked in a bleach solution and rinsed with fresh water. If necessary, hose or scrub the blood from toys, equipment, or walkways and then spray with a bleach solution. If items cannot be disinfected in this way, they must be disposed of in a sealed plastic bag. If there is blood in the sandbox, remove the affected sand. If the outdoor bicycle paths and playground areas need to be hosed down and disinfected, notify the school office for immediate assistance. And always remember to wash your hands when you are done.
How can we deal with cleaning up the playground when we all have our students with us?
Ask for help. There are plenty of people within school grounds any time school is in session. If you have to, select 2 of your more trustworthy and responsible students to go to the office to request assistance from another staff member, or so that a custodian may be called. If there is any chance of blood to mucous membrane, or blood to broken skin contact, you must use your rubber gloves and bleed the wound gently, and then wash the affected areas with soap and water. If mucous membranes are involved, simply rinse with clear water. As with all incidents, you must record the details of the accident. This includes what happened, where and when it happened, who was involved, and any injuries that occurred. You must inform the office of the incident right away. Well, this concludes the course. Remember, the important things are to document all of the facts when there are behavior or learning problems, to learn as much as you can about what causes a student to act out without assuming or judging, and to protect yourself and your students. The information covered in this course reflects the policies and procedures of the Lambton-Kent District School Board and comply with Ontario Ministry of Education practices. Most important of all, keep in mind that the impact you have on your students will stay with them for a lifetime by teaching them the skills and knowledge that they will need for the rest of their lives. Congratulations, and thank you for your time.